Vision after 40, symptoms of and solutions for age-related vision changes. This webinar is presented by Durrie Vision. Good morning, good afternoon, or good evening to all of you. My name is Tim Lindquist, and I'm one of the surgeons at Durrie Vision. I have the pleasure of talking with you today about vision changes that we experience as we go through midlife and beyond. We'll discuss a number of topics over the next several minutes, including the symptoms of age-related vision changes, the stages of those changes, collectively known as dysfunctional lens syndrome, treatment options, the benefits of correcting your vision, what to expect during the exam or consultation here with us at Durrie Vision, and the procedure process before, during, and after. We'll also touch on your vision before and after surgery with expectations there, and conclude with a discussion of next steps to take to pursue an evaluation with us here. We begin with symptoms of age-related vision changes. And really here we expect somewhere between 41 and 44 for the near vision to become progressively more difficult, no matter what your prescription otherwise, whether you're nearsighted or farsighted or neither. You're going to see a blurring of your near or reading vision that is related to the lens losing flexibility. As you progress into later periods of your 40s or 50s, the lens will also generate some haze, and that'll cause difficulty reading in dim light, trouble driving at night with symptoms of starburst, glare, and halos, and clouding or yellowing of the vision that comes along with cataract progression. To really understand where these changes are coming from, it's helpful to have a baseline understanding of the anatomy of the eye. In this schematic, you see two labeled structures, the cornea and the lens. Both of those work in concert to focus light on the retina at the back of the eye, which is the film in the camera. Whereas the cornea is a fixed focus structure that doesn't change shape or power from the time your eye's done growing, around 20 to 22, for the rest of your life, the lens does change its power and flexibility over time as it accumulates layers with age. And that's where the changes that result in near vision loss and eventually quality of vision loss and cataract occur. Those changes taken together constitute dysfunctional lens syndrome, or DLS. And there are three stages in dysfunctional lens syndrome. The first stage, what's historically been known as presbyopia, begins around age 41 to 44. The lens, though clear, loses enough flexibility to challenge your ability to read and see things up close. And though light's going through your eye cleanly with minimal scatter, use of readers or bifocals are required to compensate for the loss of power in the system. In stage 2, which is early or pre-cataract phase, the lens continues to stiffen and develop some layers of haze. This will result in increase in light scatter, where halos, glare, or starbursts are more commonly seen at nighttime. In low lighting conditions or extreme bright light conditions, such as morning sun in the wintertime or headlight glare at night, the quality of vision can be significantly affected by these changes. Over time, the lens will progress to a full-fledged cataract, which is stage 3, and in that phase, the vision quality is significantly deteriorated, particularly with regard to clarity, sharpness, and color of the vision. Depending on the stage in which the eye sits within dysfunctional lens syndrome, the treatment options will differ. Laser refractive surgeries such as LASIK and its counterparts are commonly performed for people in their early 40s through the mid to late 40s as well. Changing the shape of the cornea to adjust the power of the system allows us to take advantage of what natural flexibility remains in the lens while giving a boost to improve independence from readers to a significant percentage, 80–85% or above. Particularly in the range of vision looking at your phone to computer, you have high functionality. Over time, though, as the lens continues to lose flexibility, you will see an increased need for readers for particularly tiny tasks inside 12 to 16 inches. Because of those changes, as we get further into the 40s or certainly into the 50s, we often pursue refractive lens exchange as a more definitive treatment that will provide increasing longevity over the years. In refractive lens exchange, or RLE, we replace the dysfunctional lens with a clear artificial lens that is customized to the eye to treat nearsightedness, farsightedness, or astigmatism if those are present in the system, while also providing additional power for near and intermediate tasks. Often with refractive lens exchange, we're able to implant this technology in both eyes, which provides additional balance and increased near range, even compared to blended vision. Refractive lens exchange, because it's definitive, also prevents cataracts, as the lens we implant will remain clear and colorless, and cataract surgery will not be needed in the future. If someone's eyes have progressed to the state of cataracts, then we perform what's known as refractive cataract surgery. And there, we replace the lens again with a clear artificial one with all that high-level technology to give you range and quality of vision, but it differs in terms of surgery from traditional cataract surgery in that our goals are to give you freedom from spectacle correction. Traditional cataract surgery will replace your lens with a clear lens, but it's set for distance vision, and to achieve astigmatism correction or near vision, glasses and bifocals would be necessary. So refractive cataract surgery shoots for loftier goals, and the technology exists to be able to achieve those, which is what we do. With all those fantastic options for surgery, we need to know what is the right treatment plan for you. And to assess that, we perform what's called an advanced ocular analysis. This is the most in-depth, complete eye exam using some of the highest grade technology available to determine the path that's going to give you the greatest amount of benefit and the best quality of vision. And it involves about 20 minutes of testing of your vision and history gathering, 20 minutes of advanced diagnostics, 20 minutes with a surgeon to complete a personalized treatment plan, and then the balance of the time being spent with a surgical coordinator to go over logistics, including costs and scheduling and pre- and post-operative care. Our goal with this exam is to make sure that your eye is healthy enough and has the proper optics to achieve the highest level outcomes, and it dictates what procedure and what technology within that procedure is going to make the most sense for you. We think it's helpful to understand what to expect before, during, and after a procedure here at Durrie Vision. So we'll cover some of those details here. With regard to surgery day do's and don'ts, we do ask you to bring a driver, as your vision will be blurry for a short time following surgery. We ask you to plan on being at our facility for 90 minutes, which includes preoperative testing, surgery, and postoperative instructions. We don't want you to wear makeup, cologne, or perfume, as those can interfere with the laser. And we also don't want you to forget to fill any necessary prescriptions prior to surgery. In some cases, you will start drops prior to surgery. In other procedures, you will begin them afterward. And though you don't need to bring them, we want to make sure you have them to use when appropriate. There are differences in the process itself between laser refractive surgeries and lens-based procedures. In LASIK, there are 3 steps to clear effortless vision. The first involves preoperative preparation, including testing. The second step is preparation of the cornea. Depending on the specific laser procedure employed, this may involve a laser to make a flap or another technique to prep the cornea to receive treatment. The third step is reshaping the cornea using a laser, adjusting the shape to meet the target power of the eye to provide you with range of vision. Following LASIK, vision recovers very quickly, often towards the 20/20 mark at target within 4 to 6 hours. Lens-based procedures, refractive lens exchange and refractive cataract surgery, are similar but involve slightly different steps. Again, preoperative preparation of the eye is carried out, including testing and lens selection. We make a small self-healing incision at the edge of the cornea to gain access to the lens, and then remove the dysfunctional lens using a small instrument with ultrasound and a vacuum. Following that, an intraocular lens is inserted in place of that natural lens that sits behind the iris where the natural lens used to sit inside a capsule, and that seals in place to give you power to see across the range. With refractive lens exchange, the pupil is dilated, and often visual recovery will be noted best the morning after surgery. Postoperative restrictions and instructions are very similar between LASIK and lens replacement. We ask you to avoid rubbing your eyes for at least 1 month after surgery, and we want you to get back to normal life very quickly, which is one of the benefits of these procedures. Outside of a small lifting restriction in the setting of lens surgery, you can work, travel, exercise as normal as soon as the following day. We have you avoid wearing makeup until after your 1-day postoperative exam, and we do ask you to avoid swimming in a pool, lake, or ocean for between 2 and 4 weeks, depending on the procedure. What's remarkable about vision correction procedures is how rapid and dramatic improvement in your vision can be, particularly with near vision in regard to focus and quality, an improvement in the quality of your vision at distance, and a dramatic improvement, particularly in the lens surgery category, of things like color perception and the vividness of whites, blues, and purples. The natural lens, being a yellowing filter over time, once replaced, will often result in people saying the light just looks so dingy compared to what it does now, and that colors are really popping. And seeing those improvements in vision is really fun. So having heard descriptions of the processes and the procedures, you may ask, why Durrie Vision? Well, we'll discuss here 4 reasons why we feel this is a fantastic place to pursue surgery. One of them is the experience of the surgeons. This is our niche, this is what we do, and because of that, we have expertise from thousands of procedures and years of experience. The second component is a commitment to being on the cutting edge of technology. Through research and cooperation with industry, we're proud to be able to offer the latest and greatest technology across the fields of laser corrective surgery and lens replacement. The third is an approach that involves options beyond LASIK. And by this we mean, as we evaluate things, we're not just looking for candidacy for one procedure, we're evaluating your vision for a lifetime. We want to make sure that you know the options, and we make a recommendation that's going to give you the best result and the most optimized high-quality vision possible for the longest duration. And having all those tools available gives us a chance to do that. Lastly, the outcomes, and they speak for themselves. But you don't have to take our word for it. We survey our patients and are proud to say 99% of them say they are likely or very likely to recommend Durrie Vision to a friend or a family member. And it's incredibly gratifying to get feedback like this and see these reviews. We hear people often say they wish they'd done this sooner, or they're seeing better than they feel they have in their whole life. And that's why we do what we do, to achieve the most optimal high quality outcomes that we can and get people seeing as well as they possibly can. So we appreciate you taking the time to go through this webinar with us. We hope it's been informative, and we hope it's generated some level of excitement for you, knowing that there are some fantastic options out there to see well. It excites us too. And what's fun is that the first step is not having surgery. The first step is having an evaluation to know what your options would be. So you're welcome to visit durrievision.com to view and schedule your complimentary consultation. If you have other questions, please feel the freedom to reach out to us. We appreciate you joining us today for this session on changes in your vision that occur with time. Thank you very much.